Okay.
I'm here with Dr. Carolyn Ievers-Landis. We are so grateful that you're going to clear up some of the mystery around this pandemic and help us deal with it with our teenagers. And so, first of all, is this an overreaction, what we're seeing?
No, absolutely not. And I just was looking at some national messaging, and I was really concerned when the national messaging said, oh, you shouldn't be worried. The flu is so much worse. This probably won't affect your family. That is absolutely not true.
Wow.
So,
Okay, so from the institution you're at and everything you're seeing,
yes,
we should be taking all of the instructions seriously.
that is correct. And I'm also part of a national group, also a COVID-19 task force nationally, working with Chip Schreiber and some other people that are well known in the disaster world with children. So I have a national hook into what's going on.
Okay, so I asked our team who have kids home and kids in college, what are the things that you want answers to? And
Okay.
I'm sure they're the same questions you're getting everywhere. But the
Yeah.
big one, how do we handle anxiety? And that picture is so much bigger than just how do I personally as a mother handle it, but how do I
Right.
handle it in my kid, in my own worry for my aging parents? So anxiety in general is
Right.
rampant right now. What do we do?
The first thing I want to say is when I see anxiety, it might sound kind of odd, but I am happy that people are taking it seriously because I see the far end of that. I see skepticism and I see denial. So the first thing I want people to do if they're anxious is to pat themselves on the back and be like, I am taking this seriously. Okay. And so it's a good thing. And it's it's a protective mechanism that we're like, something's happening and I have to take action. So part of it is to normalize that as a feeling. And that it's good that you're one of the people that's feeling some anxiety, that you know you're going to have to do some things that are out of the ordinary and take special precautions. So I kind of want to look at it that way.
So that there's a healthy anxiety going on right now. So then the question is, how do we identify when it crosses over into an unhealthy anxiety?
And that was really interesting because I was dropped by the grocery store on the way home last night, and the pharmacist told me they were running out of two things: toilet paper and alcohol. That said a lot to me. There are a lot of people that are turning to maybe some healthy ways with the alcohol of coping with uncertainty and fear. So that is what I would say. And I even know from my children, talking about some of the young adults they know who are partying now and dealing with this by consuming alcohol and things like that. So I think parents need to be aware and kids need to think, do I feel like I need to drink alcohol or party to kind of numb this and deal with this anxiety? That is extremely unhealthy. And it also puts you biologically more at risk to get ill.
Okay, so that's a really important thing because I
Right.
think that will really resonate with people in a different way. Like you're actually putting yourself at harm's risk by engaging in alcohol. And do other habits make us more like I want to convince my teenager that with all this freedom of time, that they don't have school, they don't have activities, with all this freedom, that they should protect their health and wellness. So if you can tell me that risky behavior puts them more at risk, drinking, weed, whatever else, you
Right.
arm us with tools, arm us.
That's right. That's right. And thank you for saying that, because that is what I've been talking with my young adult and teenager also, is that now's the time to be healthier. We don't know how long this is going to last. We want our bodies to be as healthy as possible. We want our lungs to be as healthy as possible. So no vaping or smoking. We want our overall condition to be healthy. So not using alcohol or drugs if and when you do get it, and we all have a fairly high, likelihood at this point, you're going to fare well. And so take this time to exercise either inside, or maybe you can get outside if that's, warranted, or if it's safe, and really take care of your body. Do yoga, if you have a treadmill, get on the treadmill, eat healthily as a family. Now's the time to really pull together for every single person in your family. How can we be the healthiest that we can be?
That's such a good pivot. It's away from fear and toward action. So
Yes,
can we look back at one of the things you said, which is, at what I'm reading is that this virus is, the real fear is the lungs. Is that true?
correct.
Okay, so for kids who think they're better off not using alcohol, but smoking or vaping,
Right.
you're saying neither is,
That is correct. That
okay.
is correct. Yeah. So vaping, we already know that's not good, but at a time when your lungs might be facing a virus that's novel, that your body has never experienced before, and it can go into your lungs, you don't want anything else compromising your lungs at that time.
So it's a fine line between having these conversations about what we could do to keep ourselves safe in this moment of panic and
Right.
creating more anxiety in our kids than they're already dealing with. Do you have any recommendations? Should we encourage them to stop watching the news so much, to stop being on social media? Like, are there other, besides, I mean, you've said keep yourself
Yeah.
physically healthy. Are there other
Right.
things to keep us emotionally healthy?
Yes. So I would say that information seeking is actually healthy right now. And I've read some kind of outdated reports that'll say, oh, just look at it for X amount of time per day and then get off of it. But this is a situation that is changing all the time. I feel like this is a time for honesty. It's not a time for placating people. Like, for example, I've read things like, oh, you and your family will not be affected. Oh, the flu is much worse. Like, oh, just look at media for a little bit and then be off of it for the rest of the day. But I don't agree. I think it's actually better to just keep abreast, know what's going on. If you find out something new, let family members know. I mean, we just had a situation in my child's school, that just happened possibly. We know about what just happened with the calves. Like, these are things that are happening across the course of the day. But what I really want to focus on is the thought of the common good, because I think that that's where everyone can rise up. And whereas children and teens are at very, very low risk of actually having anything horrible happen, they might feel a little bit bad, but they probably won't even need to go to the hospital unless they have some other underlying condition like diabetes or something. But they can engage in self-safe behaviors that will protect others. And I know people that are going on spring break trips. I know people that are going on to other countries now. And I'm like, why? Why are you doing this? Yes, you're a young person, but you're going to bring back things that are going to be harmful to others. So I really want young people to think about their own morals and ethics and the ethics of their family. And we're all thinking about the common good of our whole society. I work with kids that have kidney transplants. Like, I have to think about my family. I'm like, anything you do, if I'm around a kid with a kidney transplant, I could pass that on to them.
Yeah.
So it's like, you are no longer just an individual. You are part of a greater whole. And
Okay,
that's what I want kids to get. So
well,
go ahead.
I mean, it's hard to get there quickly, but
Yeah.
I think, hopefully when we are at the other side of this story, that will be the silver lining, that, like, as a society in general, we will be able to move from, like, just looking at what's best for me and my family and maybe some greater good. So I'm just putting that out there for maybe a long-term silver lining. But in the immediacy of this, we have kids who are deeply disappointed in things that are being canceled that they have looked forward to so long. How do we deal with that? We are trapped together in homes, in environments that even under the best of circumstances, there's tension. So now we've got really disappointed teenagers who are expecting to be away on spring break. And what parenting tips do you have?
Okay, number one, I'm glad you said that. I really want people to think about kindness and how we talk to each other and how we treat each other, because right now that is so important. And it's easy when people are upset and scared, and some people are panicking, to yell at people, to get into arguments, especially because some people are taking this more seriously than others. And that's part of the problem, even within families. So I want people to take a step back and think to themselves, I don't know how long this is going to go on or how long we're going to be all together. And we're almost like, I think of it like we're all each in our own little commune in our own homes. Like, we need to really get along and really make an effort to speak in kind ways. And in terms of disappointment, we have to really think about, like, this is really prioritizing everything in your life. what is more important to you going on a trip that you can go on 3 months from now, 6 months from now, a year from now, or having very important family members or people in your community that are still living? I mean, it really is. What is more important? And I think this is a time for honesty. What's important is that we get through this. Who cares about how many sporting events we don't go to or parties? What's more important that as many of us as possible are here 3 months from now, from now, a year from now, to enjoy each other still. And really, some people I think might avoid talking like that, but I think it's a time to have those conversations.
Well, it's a little bit of an interesting situation, because if we do what we're told to do, and we kind of temper this very huge potential, and we I don't know what the right words are, but you know how, like, what we're trying to do now is level off what's going on.
Right.
And if isolation tempers it, then we're going to have a tendency to say, see, it didn't happen, and not
Right.
the causality of our behavior. So it's a little bit hard to convince teenagers who think they're invincible that there
Right.
is a causal association. So language for us, like, what's the best way to appeal to a teenager who's snarky and doesn't think you know more than they do, et cetera?
Right. And you know what's interesting though? I know you've probably seen a lot. I've seen so many teens that actually get it more than some adults do, including some physicians also. So I feel like sometimes they are really getting it. But for those who don't, it's more about saying, okay, maybe you don't get this now. This doesn't make sense to you now, but down the road, it will make sense. And all you have to do is look to China to see what happened. You know, think they were doing the exact same things we are doing now. And look what happened. And so I feel like we need to say, we don't know. We could be very, very lucky and that's not happening. And big deal, you missed a game or something. And then, you know, there weren't 100,000 people sick, you know. So I feel like part of it is just really, and also setting limits as parents and saying, no, you're not going to that, you know, event, or no, you're not going to that party, because you are putting the entire family at risk. It's not just about you. This is about your whole family and your grandparents or anyone else. Like if parents are still going to work, then I mean, it's really, that's what people are not getting, that, you know, for every one person, think of the hundreds of other people that could be affected. So it's kind of getting at that.
So on a practical note, can our
Yeah.
kids make plans with, like, say, another kid or two other kids? And is there a number where you feel like it's starting to put, you know, get into risky?
And I think, I mean, that is a question for the physicians, but I will say at our hospital, they won't allow us in groups of more than 25 now.
Mhm.
And they are recommending virtual, you know, contact whenever possible. So I would say 99% of the time, kids aren't even together most of the time anyway. So now why do you want to be together now? Like, be like we are. I'm talking to you, right? I mean, be where we are, play video games together, talk to each other on the phone. If you have to be together, maybe if this is okay, you know, with the physicians, walk outside in a park, you know, far away from other people. And it's really not the time to be getting together, but we can connect. We can talk to each other on the phone. We can text each other. We can be on social media. That's what kids do anyway. And I also want to say, I've heard a lot of negativity over like social media. And some of my patients have shared with me, like, there's like little like mean things like boomer doomer and stuff, that's what this is. Like, oh, well, all the boomers are going to be gone and let's make fun of it. And, you know, I just want kids to think about that if they're engaging in activities like that. Or are you going to feel so good about that later if somebody you know dies of this? Are you going to feel good that you were making fun of older people dying? I mean, I just don't, just like, are you going to feel good about yourself for the sacrifices you made and how you helped your family and how you were kind and really pulled together and supported people? It's really a time for kindness. It's not a time for snarkiness and meanness.
Well, it is an opportunity to rise to a better you, right? So,
Yeah.
and I mean, as a mother of 5, I dreamt
Yeah.
of that every day with my children, that today would be the day that we would all rise and be our better selves.
Yeah.
But for many families, routine is the thing that allows, like, our better selves to come out, and we are wiping out routine as they knew it yesterday. How do we go about and replace that with something new and get buy-in from the family?
Well, one of the things that I'm doing in my household is that we're thinking, and my son was just diagnosed with a couple allergies, including dust mites, unfortunately. So we're cleaning the house, decluttering, and doing things together so that we can keep surfaces clean easier if one of us, gets the virus or if all of us do. Like, how can you set up your house and how can you all, because one person's room is completely dusty or whatever, is the whole house is what they're going to be inhaling. So things like projects that you can do together, or maybe you're going to go outside together as a family, or problem solve with each other, or take turns cooking things. I feel like you can do things, play games if you haven't done that for a long time. So what can you do as a family that feels like a group effort and pull together?
Okay, I think I'm winding down, but I have a question
Yeah,
about, so we are sandwiched, right? Like we have these teenagers, but we also have these aging parents who may not be
right,
living where we are, or even if they're living near us, don't want to be bossed around by us. But what we're hearing in the news is that our parents are at the highest risk.
right.
So, I've heard it over and over again from people that they're saying to their parents, please don't go. And the parents are like, not for you to tell me, which creates another layer of anxiety about people that we love. So are there?
No. Thank you for bringing that up because I think that we can do what we can. We can tell them what we've read and heard because I feel like a lot of us are reading maybe at a different level than our parents. We kind of know what sources to go to, like the CDC or different things. And maybe our parents are getting those sources or not. But I find that most of the time they're not having the information that I have. Even my patients' parents are like, I'm telling them information. They're like, where did you find that out? I've never read that. So I feel like we need to arm our parents with information, but they are adults and they are going to do what they're going to do. And, there's really not much we can do. And we want to preserve our relationship. Like, we don't want to get into arguments and fights with them and then have them succumb. And that's our last memory. So I feel like arm them with information, respectfully, like offer to help out, to get supplies or do things that you can, and then just let them live their lives however they choose to do it.
That
It's
is the
hard though.
hard truth.
It's such a hard truth, right?
Okay, my last question. I want to go back to something you said because I think we're trying here to narrow in on some really good hard and fast rules for people. But if you have a kid who you see that they are overwhelmed with anxiety and are sitting in front of a screen reading all the news, can we say that it depends on your kid when we say let them get more information? Like, would you agree that a kid who is highly anxious with the information, you should temper it a little?
I think you should talk to them. Talk to them about what they're reading. Like, let's talk about it. What does that article say? Let's talk about it. And then you might be at some point be like, well, can we do something else? Let's make dinner. Let's go outside and get some sunlight, and it's like, it's not going to hurt to be away for an hour or two or more. But I also want to tell you that we are trying as psychologists across the country to try to do telehealth, telemedicine. So we're trying to see if we can bill and see our patients virtually so that people like you're discussing that really want to talk to a professional will be able to see people without people having to leave their homes. And that's a huge effort right now because we have to talk to the insurance companies and we have to talk to our employers. So we do want to support people like that. But I think the most important thing, which is really life or death, is to find out if kids are thinking of self-harm. If your child is really upset or distressed or really withdrawn, or ask them, are you thinking of harming yourself? Because that's something you can't come back from. That's something that's very, very important, that you want to make sure in the midst of this that someone isn't at that level. So don't be afraid to ask that question.
So I want to just jump on that because as a parent, there's a tendency to feel like asking it is suggesting it. But I think there's research that shows that asking it, you'll get a pretty honest answer. Is that true?
That is correct. And I cannot tell you how many times, because I pretty much have to obviously ask it if I have someone who's depressed or has depressive symptoms. I literally ask it like every day practically. And so many parents had no idea. But then the kid says it right in front of them. So
Really?
it's like, yeah. And I want to give you guys this tip because this, as a psychologist, this might be golden for some parents. what I say first is I start with passive suicidal ideation. I say, have you ever thought about like you just wish you weren't here, or that you could just disappear, or maybe even that you've never been born? Is that something you ever feel? And we call it passive suicidal ideation. And then the kid might be like, yeah, I have thought of that, and I'm like, oh, tell me about that. And then I'll say, well, have you ever had an actual plan? Have you ever thought of an actual way? And I just talked to a kid yesterday, and they're like, yes, I did. I thought about taking all my medications. And I was like, okay. And this kid has diabetes, so has insulin at the ready, which is very dangerous. So wow, that just came out just from me saying, starting with that, like, oh, you wish you just weren't here, could disappear, or just, that sort of thing. So if you start with that, and then they kind of say, oh yeah, and then you can move on to the plan, because that's when you need to know, well, tell me exactly what the plan is. And you have to also say, I'm not going to drag you in. That's what they're worried about. Drag you into the emergency room just because you told me you've been thinking about this. And say, but if you tell me you're thinking of it and you can't stop yourself, you're going to do it. That's when I have to get you help immediately.
And does that keep them from being honest with you because they don't want that next thing to happen?
I feel like most kids will tell you I have had kids say, yeah, I'm doing it. I'm going home now and I'm doing it. And so I'll be like, well, okay, I need to send you to the emergency room. I've literally only had one kid do that. I mean, most kids, if you say that, they'll say, well, I'm thinking about it, and right now I'm not thinking of doing it. And so the only thing you need to say is, I want you to tell me if you're thinking of it again. I need you to tell me so I can keep you safe, because I don't want to just leave you up in your room for hours and not check on you or something, or have these substances or these means available, so you really just need to know. So I want parents just to not be afraid to ask that. And kids are really good about telling you that. It's amazing to me, the level of detail you can get.
So we did go into a much more serious conversation.
Yeah.
To end on, well, we hope, actually, who knows what we hope for, because both are bad, but we started talking about the virus. We are hoping that people pay attention to what the public professionals and leadership are saying to us.
Yes.
And then as far as our own kids and how we parent them, it does feel like what you said is a little bit of an opportunity to just have everybody band together and be their best selves.
I feel like it's kind of a way of almost being equals a little bit. I don't want to say that. I mean, I'm still, into authoritative parenting and democratic parenting and, having firm controls, but warmth. But in a way, we're all in this together. We're all human beings. We're banding together. So I actually see it as a time for real bonding together. I feel that even, this is so cool. I was literally in 2 stores yesterday. Every single person I saw was like, take care of yourself. Hi. Like, I mean, there was warmth from every single person that I interacted with, because they were thinking to, themselves, and I was of them, are you someone that's going to sick? Are you someone that's going to go to the hospital? So I feel like it's a real time for bonding for our entire world, not just our country.
All right. Well, thank you so much for your time. This was unbelievable. I really appreciate it. And we're going to share it with our audience today. So thank you.
Thank you so much.